Welcome back to CLE Weekend. So, this time of year, it's unique, right? For a lot of Ohio Medicaid members. The Department of Medicaid, they are conducting unwinding and open enrollment at the same time. So a lot of these activities that can affect millions of Ohioans. So to help explain what Medicaid members need to know, I'm here with Buckeye Health Plan's Chief Medical Director, Dr. Brad Lucas. So thanks for coming on.
Thanks for having me.
Let's start with the medical unwinding. Well, what is this?
Well, first, Medicaid is great coverage for a lot of Ohioans. During the public health emergency, Ohio was smart in that everybody was able to continue on their Medicaid coverage and they didn't have to re-enroll. Well, now the public health emergency is gone, so we're kind of going back to the way it used to be before the pandemic, where you have to fill out paperwork or get online and enroll and make sure that you still have your coverage.
Yeah, we want to make sure people, of course, do remember to do that. So walk me through, what do Medicaid members need to know?
Need to know you can go to your Ohio Medicaid website. And you can fill out things online. You can call your health plan. You can call Buckeye Health Plan. Okay. You can appear at your local County of Jobs and Family Service office and go there. You should also get a packet to enroll from your local Ohio Department of Health and Human Services to fill that out. You can do that online or bring it on in or mail it in.
There's a lot of options. Yeah. Now, for some people, though, who maybe don't remember to reapply, for their deadline, what would you say to them?
Well, if you need your Medicaid eligibility, you need to re-enroll.
Yeah.
Now, for some members who they're not up for re-enrollment, meaning they already have coverage right now, and they're not up for re-enrollment, it's also a time of the year where you can change from one plan to another. You're doing that, you're looking at the services that a health plan provides, the benefits, what kind of trips do they, transportation, what other services can they attach you to, and customer service and important things like that. So you can change, and if you're comfortable with who your health plan is, you don't need to do anything at that point, and you'll be automatically re-enrolled.
Okay, that's good to know. Now, in terms of members, to make sure that they've renewed their benefits, again, this is key.
Right. So when you join a health plan, a Medicaid health plan, each plan has similar but a little bit different benefits. For instance, at Buckeye, you can get transportation to doctor's appointments, a pharmacy, for social services, to the grocery, to food banks. Different health plans will have different dental or vision benefits. At a lot of health plans, certainly at Buckeye, if you achieve some certain wellness types of things, annual preventive health screenings or seeing your doctor, get your flu shot, you get certain amounts of money. In pregnancy, for pregnancy care, you can get as much as $350 if you go through all of that care. And similarly, seeing your doctor for important checkups. So those are things you think about when you're looking at the different health plans.
Yeah, and it is. You want to make sure people take their time, right? They sit down.
Yeah, it's important.
It's not just a quick thing that you should do. Now, the Ohio Department of Medicaid also holding the annual open enrollment period. What is that?
That's what we're talking about now. That's your option to, the month of November. You'll get information. You can find information online about the different health plans. And again, think if you're comfortable with your health plan and the doctors that are on that health plan, or if you want to, maybe you need some different coverage or services or benefits, you look through that.
Now, in terms of updating contact information, right? Because maybe we moved or changed. I mean, that's pretty important
Very important. All of the health plans want to do everything they can to help their members and their families and their health. And we're very limited if we don't have the right contact information. So updating contact information is something you really want to make sure you're doing.
And not all health plans are the same,
no.
Right? So that's why we say you want to make sure to give some time. But in terms of members thinking like some things that they can keep in mind, what are some good key things for them as they're making their decisions?
Again, I'd say the services that you feel that you need and your family needs, the benefits that make sure you understand the benefits of the health plan and you use those, because that means it's not a cost and they can be really helpful. So understand those benefits, and then really understanding like the healthy care that you need to have during the year, preventive health screenings, be mindful of those, and if you're due, and then you might check and see, well, if I do that, what kind of reward do I get? At Buckeye Health Plan, our mechanism is called My Health Pays.
This is the rewards program.
Yeah, the rewards
program. Okay, so tell me about this.
Yeah, say, for instance, you get your flu shot. We want everybody to get their flu
Yes.
shot. Most people certainly speak with your doctor. That's $25 to get that flu shot. So different types of things to reward you for the time and effort to arrange your day and keep up with those things.
Well, incentives, right?
That's what it is.
Yeah, I mean, these are the things that we want you to do. Now, for Medicaid members who already have Buckeye with their, coverage right now, what do they need to do, again, to keep this coverage?
You need to know if you're due for re-enrollment.
Okay.
You should be able to check on that by calling Buckeye or visiting the Ohio Medicaid website. So check if you're due for re-enrollment. If so, then make sure you re-enroll before that date. And if you're not due and you're content with your health plan, you're fine. You don't need to do anything.
Yeah.
If you want to make that switch, do that.
Now, if someone wants to switch to Buckeye, they can do that as well.
Yeah, I mean, I think all the health plans are fantastic in Ohio, and if you see something that might be a better option for you or for your family, you can do that through that enrollment paperwork process.
Wonderful. Where can we get more information then?
You can go to the Ohio Medicaid website online is what I would recommend. I think we have that information. You can call Buckeye Health Plan. You can stop at the Ohio Department of Job and Family Services.
All right, wonderful. Dr. Brad Lucas, thank you. You give us lots of information. Again, lots of good tips, reminders, things to really think about. So I appreciate that. You can visit choosebuckeye.com for more information. Thanks again for coming.
Oh, thank you.
Us. We'll be right back here on CLE Weekend. Stay with us.